connecting, please inform. Can you hear me? Good morning, everyone. The Ministry of Social Justice and Empowerment under Nasha Mukht Bharat Abhiyan celebrates Sashakt Bharat. Today, we bring Nasha Mukht Bharat Abhiyan in a multidimensional focus, introducing Mission Life and Nai Chetna to highlight the importance of different stakeholders in making the society Sashakt. I am Ishwan.
And I am Astha Hazarika, Senior State Coordinator for the Ministry of Social Justice and Empowerment. We welcome you all to today's interview. We are celebrating Sashakt Bharat under Nasha Mukht Bharat Abhiyan from November 28th to December 7th, 2022 to discuss the convergence of gender, substance use disorders and environmental issues. Now, I would like to call upon Syed Hamad and Ananya from the PMU to elaborate further on the NMBA and Sashakt Bharat.
Thank you, Astha and Ashwin. I'll just share my screen. Please confirm when it is visible. I hope it is visible to all of you. Yes, sir. Is it visible? Okay, perfect. Thank you, Astha. So as my colleagues have mentioned, today we are covering upon Nasha Mukht Bharat Abhiyan and the subsequent themes, that is Sashakt Bharat Abhiyan. Nasha Mukht Bharat Abhiyan is currently being implemented across 372 districts in the country. The base of the event was after a survey was done by Ministry of Social Justice along with AIMS, wherein it was identified that there are 16 crore people across the country who are consuming alcohol, 3.1 crore people who are consuming cannabis, and 2.26 crore people who are consuming opioids. Based on these figures, Nasha Mukht Bharat Abhiyan was launched. Currently, it is being implemented across 372 districts. In 2020, on 15th of August 2020, it was launched in 272 districts. This year, on 15th of August 2022, after 2 years, 100 additional districts were added in the campaign. Following are some of the objectives of the Abhiyan. I will list down each of them. The first one is to create awareness among the community by doing on-ground creative activities and through social media. Second one is to reach out to higher educational institutions, universities and schools. Then it is to reach out to the community and identify the population who is dependent and consuming the substances. Then it is augmenting counseling, addiction and treatment facilities and rehabilitation centers for the people who are already addicted to different kinds of substances. Then it is about capacity building of the service providers, that are the NGOs, that are the social enterprises that are working towards de-addiction in the country. And lastly, the focus is upon mental and physical well-being of the youth and adolescents. Moving further, these are some of the glimpses of when the Nasha Mukht Bharat Abhiyan was launched on 15th of August 2020. We can see the Chief Minister of Himachal Pradesh and Sikkim launching the event in their states as well as in Telangana, Haryana, etc. So the most important part and integral part of the Nasha Mukht Bharat Abhiyan has been its master volunteers. So far, we have been able to connect 8,000 master volunteers across India. These master volunteers come from a varied background, which includes education, health, enforcement, youth and sports affairs, community-based organizations, women and child development department, and legal services. These master volunteers are regularly trained and given sessions and master training by the ministry through NISD. These are some of the snapshots of the trainings that have been done so far and implemented in different states. We can see snapshots from Madhya Pradesh, Tamil Nadu, and Manipur. Moving further, women have been a very integral and strong part of the Nasha Mukht Bharat Abhiyan, and they have played a very pivotal role in making the Abhiyan successful. They have been doing it through several ways, through Mahila Mandals, with the help of Anganwadi workers. They have been organizing rallies across the country. They are doing door-to-door visits, awareing people about substance abuse, how we can take precautions, how we can help people who are already addicted to them, how we can help them to reach out to the rehabilitation centers of the government and private facilities. Then next is the youth programs that we have been conducting under the Nasha Mukht Bharat Abhiyan. So far, there have been more than 1 crore youth that have associated with Nasha Mukht Bharat Abhiyan. We have also been able to form 1,500 plus clubs across the country. There are 4,000 plus youth mandals, Yuva mandals in the country. plus we have been able to gather a team of 300 plus social media interns who come from reputed institutions across the country. These are some of the glimpses of the programs that have been conducted by youth in Nagaland, Delhi, Uttar Pradesh, Manipur, etc. So this is a glimpse of so many education institutions who have associated with Nashamukh Bharat Abhiyan. So far, 56,000 plus institutions have been working with us in making the country drug free. These are some glimpses from Bihar, wherein you can see students have been taking oath. There are rallies which are organized, and there are other different fests. We have also collaborated with top universities across the country, which includes Christ University, MIT, Jamia Millia Islamia, etc. These universities have been helping us in reaching out to the youth, especially through different activities like pledge, like Nukkad Nataks, rallies, pamphlet distribution, etc. We have also been targeting the special bordering areas since we know that major supply of drug in the country is from two specific areas, that is Golden Triangle and Golden Crescent. So we have been reaching out to the army personnel, that is CAPF. To them, we have been reaching out to the villages which are located close to these two specific areas. Then there are several community programs that are organized in different districts, which are for mass awareness. There are citywide campaigns. There are awareness years, van and mass awareness in districts. There are Nukkad Nataks which are organized, and there are community rallies which are organized at block level, district level, etc. Then we have also been leveraging upon social media since youth has been very much active, and so far we have been able to reach out to 2 crore youth. Plus, expect through our 1,500 plus interns team, we have so far shared 63,000 plus posts on our different social media platforms. You can follow us on Instagram, Facebook, and Twitter. We also have our website wherein you can reach and look for all the details pertaining to Nashamukh Bharat Abhiyan. There's real time data, whatever the activities are being conducted across the country. Then there are panel discussions which are also conducted, and there is a monthly newsletter wherein we capture and encapsulate whatever the activities has been done in the campaign in a particular month. Then there is also online training service that through Tapas, that is training for augmenting productivity and services, wherein you can go and learn about drug abuse, how to prevent it. There are 12 modules. You can reach out to the website, go through it and learn, and also help and aware your school or community. Moving further, we have also focused upon school children, wherein we have launched our Navchetna module to aware and teach the students who are in school about the disadvantages of consuming substances. Lastly, we have been able to cover 3 crore plus people so far across the country. There are more than 55,000 educational institutions who have associated with us. There are 32 lakh plus women who are associated with us, and they have been covered under the campaign. 1.59 crore youth have also been reached out. As I had mentioned earlier, 100 new districts were added under Nashamukh Bharat Abhiyan 2.0 after 2 years, that is this year on 15th of August 2022, making the total number of districts to be 372. Thank you. That's all on Nashamukh Bharat Abhiyan. I would now request my colleague Ananya to please take over and cover on Mission Life. Thank you. Okay, thank you. Audio is clear? You are hearing? Sorry, Ananya, to interrupt you. I think your audio is not clear.
Am I audible? Everyone?
Yeah, perfect. It's all right now.
Okay,
Please
so
go
I'll
ahead.
start over. Sorry for the glitch. Good morning, everyone. My name is Ananya, and I have overview of Mission Life, which is an acronym for Lifestyle for Environment. The basic premise, next slide. Yeah, the basic premise behind Mission Life is the fact that a significant portion of global carbon emissions are a result of simple lifestyle choices that we as individuals make in our daily lives. For instance, taking a cab instead of metro, asking for polybags where we could have easily carried a bag from our home. According to the United Nations, if only 1 billion people out of the 8 billion of us decided to make sustainable next slide. Therefore, it is with this mission it aims to influence an environmentally conscious lifestyle among individuals as well as organizations by focusing on 3 core shifts. That is, changing demand by influencing a sustainable lifestyle among individuals, changing society to adapt these changing demands, and finally changing policies facilitate previous two. A comprehensive but non-exhaustive list of 75 life action choices under 7 broad categories has been developed, and we shall be going over those now. Next slide. So the first is energy, saving energy through actions such as using public transport wherever possible, cooking and heating, among other things. Next is saving water, using innovative conservation techniques, harvesting rainwater. Next is to minimize the usage of single-use plastic and replace them with sustainable alternatives. Further, we need to reduce the amount of e-waste that we produce. In addition to that, we also need to transform our food system into a sustainable one. Along with that, we need to minimize the amount of waste that we produce by, for example, choosing to donate instead of throwing away. And finally, we also need to adopt a healthier lifestyle for ourselves. Next, we move on to Nai Chetna, next slide, which is launched by Government of India on the occasion of International Day for the Elimination Against Women on November 25th. Gender equality, as we know, is critical for upward progression of any society. Deen Dayal Antyodaya Yojana, that is National Rural Livelihood Mission, under the Ministry of Rural Development, through its gender interventions, have been making strategized efforts in addressing issues of gender equality. Hence, a month-long campaign has been designed to create a concerted effort in acknowledging, identifying, and addressing the issues of violence against women. Next slide. Yeah. Slide before this. Slide before that one.
Array,
Second,
goal one.
second slide. Before that. I think there is a lag. Yeah. For the next few years, campaign common understanding and recognition of disadvantages and discrimination faced by women across all levels among community institutions, rural community department. The campaign will help women identify violence meted out to them due to the normalization of gender-based discrimination and violence. It will create public awareness about redress mechanisms for the victims of violence. The theme for this year's campaign is violence. It will be organized from November 25th to November 23 to December 23 this year. Next slide. The main goal of the campaign is advancing the agency and rights of women and gender diverse individuals by addressing structural barriers for dignified living with no fear and discrimination and violence based on their gender and intersectional identities. Next. The campaign will deepen the understanding of gender through a multi-sectoral approach where the Ministry of Social Justice and Empowerment plays an important role. Substance abuse is one of the major contributing factors to gender-based violence. Therefore, it is critical for us to look at it through an intersectional lens, both in terms of impact and cure. Through this panel discussion, we would be unwrapping the link between gender-based violence and drug abuse and drug use with our esteemed panelists. And now let's thank you.
Thank you so much, Ananya, for the insightful presentation. Now, moving further, today we have an essential panel for the audience. Under Let's Talk, we have invited individuals with experience in institutions catering to victims who use drugs across the country. These institutions focus on preventive education, awareness generation, identification, counseling, treatment, and rehabilitation of individuals with substance dependence.
The guests have been members of these institutions for years and have made significant contributions to drug demand reduction. Because of our Sashakt Bharat's aim and the panelists' expertise, we aim to bring a synergy between perspectives about how we can talk about the importance of NMBA in terms of how we sustainably carry out the activities in the institution, at the same time making people aware and include women's role in this convergence.
With this, I would like to introduce our guests. Our first guest is Ms. Durga Tripathi from Panna, Madhya Pradesh. She is the president of Jan Jagran and Samaj Utthan Parishad organization. Our second guest is Dr. Alpa Vyas from Gujarat. She is the counselor for the organization Gujarat Kelavani Trust, Gujarat. Our third guest is C. Lekha from Kerala. She is the project coordinator at Galaxy Kerala. And lastly, Mrs. Madhuri S. Bhayagade from Maharashtra, Director at Aniket Bahudeshya Sanstha. Thank you all for coming to this session today. An essential element while talking about Sashakt Bharat is to address sustainability measures. So we will create a conversation that brings sustainability to these institutions today.
So, to start the conversation around the same, my first question is to Ms. Durga. Have there been any sustainability measures taken by your organization, and what are the efforts you are interested in taking in the future? Durga ma'am? Um,
Given that Durga ma'am is not able to join the interview right now, we'll come back to her later. Until then, uh, we'll start with Dr. Vyas. डॉक्टर व्यास आप अपनी संस्था की कार्यप्रभारी हैं और इन्होंने अपनी संस्था के माध्यम से वंचित वर्ग के उत्थान के लिए काफी काम किया है। तो मैं आपसे जानना चाहती हूँ कि आपको इस दिशा में कार्य करने की प्रेरणा कहाँ से मिली? डॉक्टर व्यास, क्या आप मुझे सुन पा रही हैं? डॉक्टर व्यास? Can I please request the panelists to switch on their cameras?
we, we apologize for our guests. Or I will move on to the next participant. This is for Ms. C. Lekha. If you could tell us, are NGOs in generally equipped to cover elements of Sashakt Bharat? Ma'am, you're muted.
Good morning, all. I am very delighted to be here in this occasion. I hope everyone's doing well. Thanks for inviting me. Sachat Bharat encompasses a strengthened health and education sector, environment, gender equity, and many other sectors. With respect to the current theme of Mission Life, Nai Chedana and Nashamuk Bharat Abhiyan, I believe NGOs have been performing an instrumental role in the fight against drug addiction in the country. Under the umbrella of Nashamuk Bharat Abhiyan, NGOs have been running the De-Addiction Center, CPLIs and audits, and are creating mass awareness among the masses against drug abuse. However, I believe there needs to be greater emphasis on the capacity building of the NGOs in form of sessions, webinars, and funding. NGOs have also been working in the area of environment sustainability by creating awareness and doing cleanliness drives. More NGOs need to be roped in for the same. Regarding gender equity, I believe NGOs have played a very big role in women's empowerment through the means of advocacy, capacity building, awareness, and strengthening their will. NGOs would need additional support from private and government funders for strengthening their fight against specific issues such as gender-based violence. There needs to greater focus on awareness and social and economic empowerment of the women. Thanks.
Thank you, ma'am. I understand you've focused on the advocacy part and how you'll need external stakeholders to help you solve these issues. But have you taken any steps in the organization to incorporate the elements of Sashakt Bharat, and has there been any impact on these measures?
Sure, ma'am. We gave the training of training awareness of women empowerment, and in the de-addiction sector we gave counseling, so many outreach programs, Gramina Yatra, means remote area travel for awareness for the society, and environmental progress. We do many things for these things.
What kind of impact have you seen? What did these awareness programs, like the training awareness for women empowerment, let's say, have done for the people who actually participated? So if there has been any sort of a development or a change that you could bring, what were those?
Okay, ma'am. First of all, I would like to talk about women empowerment. Women empowerment program can be planned in 5 categories. They are social, educational, economic, political, and psychological. In social category, training is very much important. Investing and building the capacities of rural women will improve their business, social, economic, and financial skills. For this, we can provide an aptitude questionnaire. Through the aptitude questionnaire, we can categorize the women for training, sharing, listening, collaborating and cooperating, patience, empathy, respecting boundaries are the social skills. Communication, adaptation, acclimatization, conflict resolution are the other social skills. We wish to prepare a module for the training including these. Now I am going to talk about educational category. Adult education is very important in educational category. The literacy rate in a rural area is 73.5%. But in Kerala, it is above 85%. Through adult education, we can equalize the individual differences. We can uplift and upgrade them, even in digital or cyber training. Through adult education and cyber literacy, we can uplift the women's creative activities. You know, majority of our women are addicted in screening, especially in evening. There are no gathering, cultural or creative activities because of this addiction. It affects the family cohesiveness. So adult education is very much important in village areas. Next, I am going to talk about economic category. Gender discrimination is one of a major issue in our society. Usually, men have a dominant role over women. So, majority of women depending on their husband even for small expenses in daily life. So, economic empowering and sustainability is a needful one for women. Our organization has a plan to coordinate women in small-scale industry through our Al-Anon groups. We have a strong Al-Anon group named Gayatri Gramaseva Kendra. The administrative section of our organization is led by women. Now I would like talk about political category. Although there are reservations, the majority of women have it come forward in political interventions. There is a situation where there is no clear political position. There are plans to organize readings, seminars, and discussions on feminist books. Now I will talk about psychological category. There is first aid for physical health, but when it comes to mental health, there is no first aid. First aid in mental health is essential for ordinary housewives because things like hyperactivity and learning disorder are increasing. Through this, you can recognize these things and understand what needs to be done. These are the module for women empowerment.
Okay, I mean, saying that there is no first aid for mental health, I think that makes a lot of sense. And it's great that you are taking out a module based on these categories that you think are important, and they definitely are. Thank you so much for answering my questions. Ishwin? Okay. My next set of questions is for Miss Madhuri. Is she here? Yes. Yes. Hi, ma'am. Would you like to share an instance from your journey that kept you motivated throughout working in this sector? And how is it to be a woman, and what are the challenges that you face every day as being a member of this entire drug awareness, drug demand reduction program?
हेलो
Yes, ma'am.
मैम हिंदी में पूछिएगा.
Okay.
I'm so sorry, ma'am. There's some technical glitch. Okay, so मैम मैं आपसे जानना चाहती हूँ कि आप इस नशे से लिप्त लोगों के साथ जो काम कर रही हैं उसके लिए आपकी प्रेरणा क्या है?
गुड मॉर्निंग मैम. हम बचपन से आजू बाजू के परिसर में देखते आ रहे हैं कि लोग शराब से काफ़ी परेशानी है. वातावरण वैसा ही है समाज में, और शराबी लोगों से काफ़ी परेशानियां होती है, घर के वातावरण बिगड़ जाते हैं. और हमने सोचा कि काफ़ी घर के लोगों का वातावरण बिगड़ता है, और काफ़ी घर में टूट जाते हैं, रिश्ते टूट जाते हैं, फैमिली डिस्टर्ब हो जाती है, बच्चे डिस्टर्ब हो जाते हैं. और इसलिए हमने सोचा है कि चलो आजू-बाजू का सब परिसर देखते हुए हम क्यों ना लोगों की सेवा कर दिया जाए. और एक बार हमने देखा कि एक शराबी पति और उसकी मिसेस गर्भवती थी, और वो ना कि ढंग से उसको हॉस्पिटल पहुंचा पाया और ना कुछ. उसमें ये हुआ मैम कि वो रास्ते में ही उसकी डिलीवरी हो गई. इसलिए वो शराबी पति ना उसको ढंग से हॉस्पिटल पहुंचा पाया और ना कुछ सेवा मिल पाई उसको हॉस्पिटल की. इसलिए हमने सोचा कि नहीं, कुछ ना कुछ सेवाएं की जाए लोगों की, कि जिससे उनमें कुछ बदलाव आ जाए और कुछ फैमिलियां अच्छे से अपने घर में घर गृहस्थी बसा पाए. इसलिए हमने 2012 और 13 से व्यसन मुक्ति और डायरेक्शन सेंटर चालू किया है, और ये भी हमारा डायरेक्शन सेंटर ग्रामीण में है मैम.
मैम आप बहुत ही अच्छा काम कर रही हैं, आप बहुत सी महिलाओं के लिए एक प्रेरणा का स्रोत हैं. मैं आपसे जानना चाहती हूँ कि आप जब ये काम करती हैं, ऐसे फील्ड में जाती हैं विजिट करके, तो एक महिला होने के नाते आप किस प्रकार की समस्याओं और चुनौतियों का सामना करती हैं?
मैम हम तो जैसे फील्ड वर्क में जाते हैं, हमारे प्रोजेक्ट मैनेजर भी आते हैं और हमारे काउंसलर भी हमारे साथ में आते हैं. तो इसे महिलाओं की इतनी सारी समस्याएं रहती हैं कि उनको लगता है कि यार पति अगर शराबी है तो पूरे घर में ही डिस्टरबेंस हो जाता है. और कैसे है कि बच्चों के पढ़ाइयों में भी डिस्टर्ब होता है. इसलिए हमने महिलाओं को एक प्रेरणा दी है कि नहीं, तुम डरो मत, हम अपनी तरफ से जो प्रयास होता है वो प्रयास हम पूरी तरह से आपके घर में वातावरण अच्छा रहे इसमें सहयोग करेंगे.
तो मैम जब आप ऐसी महिलाओं से मिलती हैं तो वो अपनी समस्याएं आपके साथ व्यक्त करती होंगी, आप उनके
हाँ
साथ बैठ के बात करती होंगी। इससे बहुत ही ज़्यादा बहुत सी महिलाओं को प्रेरणा मिलती होगी, वो आगे बढ़ें, कुछ करें। तो ऐसे आप कभी किसी ऐसी महिला से मिले हैं जो आपसे आपसे जिसने ये कहा हो कि हम भी आपकी तरह कुछ करना चाहते हैं, हम भी अपने जीवन में कुछ पाना चाहते हैं आपकी तरह, जिस तरीके से आप कुछ अच्छा काम कर रही हैं?
हाँ, ऐसी तो महिलाएं चाहती है मैम, लेकिन कैसे किसी किसी का फाइनेंशियल ये भी है, फाइनेंशियल फाइनेंशियल प्रॉब्लम आ जाता है, तो कुछ कुछ महिला ऐसा नहीं कर पाती है।
हम्म।
और जैसे बचत गट की महिलाएं हैं, वो भी अपना कुछ कर पा रही है।
मैम हम सब जानना चाहते हैं कि जब नशे से में लिप्त लोगों की के प्रति कार्य करने में महिलाओं का क्या योगदान होना चाहिए?
उसमें तो महिलाओं का योगदान काफी होना चाहिए मैम।
किस प्रकार से योगदान दे सकती है महिला, बताना चाहेंगे कुछ? आप ये जैसे आप इतना अच्छा काम कर रही हैं इस क्षेत्र में, आप एक महिला हैं, आप महिला होने के नाते इतना अच्छा काम कर रही हैं, तो आप और महिलाओं को भी प्रेरणा देना चाहेंगी कि आप भी आगे आइए, बढ़िए, मेरी तरह कार्य कीजिए, इस क्षेत्र में लोगों की मदद कीजिए, है ना? धन्यवाद मैम, आपके साथ बात करके बहुत ही अच्छा लगा हम लोगों को। आप बहुत सी महिलाओं के लिए एक प्रेरणा का स्रोत हैं।
ओके मैम।
मिसेस दुर्गा, आप मुझे सुन पा रही हैं? मिस दुर्गा त्रिपाठी? मिस दुर्गा त्रिपाठी? डॉक्टर अल्पा व्यास? Hamad, would you like to add an opinion about how women can contribute into a area which is very less ventured by women, like working in the area of helping people coming out of drug abuse, drug usage?
Definitely, as I had covered during the presentation of Nasha Mukht Bharat Abhiyan, and in my personal experience also so far, going on the field and meeting with different women and different NGOs, I do believe women through their different, institutions, specifically when it comes to Anganwadi. Currently, there are approximately 40 lakh Anganwadi workers across the country. These Anganwadi workers are well rooted and connected on ground with all, specifically to the youth. They are also in a form of unelected leaders of their community, and they are hugely respected. So I do believe that these Anganwadi workers could be leveraged upon for spreading our message of, Nasha Mukht Bharat Abhiyan, and they could also be used and taken help of, and they could assist us in creating awareness on ground, reaching out to the youth and local community leaders, specifically religious leaders. I believe since I had went to one of the districts and wherein I identified one or two, three Anganwadi workers who had shared their personal experience with me. They were telling me that how they had reached out to a local religious leader uh, who had a good hold on the community. They reached out to him, and with help of those two women and the religious leader, they were able to organize a big session for the youth of the community, and there was huge turnaround from many, from housewives, from mothers, from sisters, because they were very concerned about the health of their children because they don't want them to consume tobacco or cigarette at a very early stage. So that has been a very close experience of mine, and it was an eye-opening experience, and it had helped me turn around that how how much connected and deep-rooted women are on ground, specifically the Anganwadi workers or per se the teachers. If we see the ratio of female teachers in school, it is much higher compared to male teachers. So they have a greater, they can contribute in a much greater way, I believe. Coming to the NGO part, that how women can play a pivotal role in NGO, that too I see the way Srilekha ma'am and Madhuri ma'am has presented people, they are absolutely right in their opinions. As Srilekha ma'am has pointed out, that there needs to be a greater emphasis on capacity building of the NGOs, specifically NGOs who are working towards women causes. And as has been the theme of Nai Chetna, the focus towards gender-based violence, we need to also rope in the other community-based organization plus the police department with us, so that they can also, tie up with the women of the community and create awareness programs. They can build capacity and awareness among women about different laws which are there for them, There are several policies which are by the government for them. They should be, they should get to know about them. Unless they know about their rights, the laws and policy which are for them, they can't speak. So it's very important. And also, even after knowing their rights and laws, it's also important that they are given that confidence and that economic and social empowerment that Silekha ma'am was pointing out. Many times what happens is it is the economic empowerment, economic dependence upon the male, due to which they constantly face this, unintentionally they have to face it, and because they are out of any options, so they have to go through that violence. So if they are given that economic independence, they can go on with their own work, and then they can be, they can come out of this vicious circle of violence which they regularly face. Sometimes we have seen through different case studies how in after intervention from police and NGOs also, in some cases women do not prefer to leave, such kind of institution of marriage, because they have this so much economic independence upon that husband that they do not have any other place to go. So in that area also, we need to work a lot. uh, Along with awareness, there need to be capacity building and economic independence of women. Thank you.
Thank you so much, Amat, for sharing your opinion. It was very insightful of you. I think Dr. Vyas is with us. मैम आप मुझे सुन पा रही हैं? मैम आपकी शायद आवाज नहीं आ रही है. आप मुझे सुन पा रही हैं? मैम आपका
हेलो
माइक ऑन नहीं है. हेलो.
हेलो
यस मैम.
हो गया
हाँ जी. हाँ जी मैम. हाँ जी मैम.
जी मैम
मैम मैं आपका स्वागत करती हूँ हमारे आज के इंटरव्यू पैनल में. आप
थैंक यू
हम मैं सभी को बताना चाहती हूँ कि डॉक्टर व्यास अपनी संस्था की कार्य प्रभारी हैं और इन्होंने अपनी संस्था के माध्यम से वंचित वर्ग के उत्थान के लिए काफी काम किया है. मैम मैं आपसे जानना चाहती हूँ कि आपको इस दिशा में कार्य करने की प्रेरणा कहाँ से मिली?
हाँ मैं यहाँ 25 इयर्स से काम कर रही हूँ संस्था में. और जब से मैंने ज्वाइंट किया तब से मैंने देखा कि एक एक जो यहाँ पर पेशेंट आ रहा है तो कितना पीड़ित है वो. और ये जो नॉट अ इंडिविजुअल डिसीज बल्कि वो फैमिली डिसीज है. हाँ, तो पूरे परिवार बहुत ही दुखी है. और बस तब से मुझे ऐसा हुआ कि नहीं, उसमें ही काम करना है कि एक एक परिवार उसमें से बाहर निकल जाए. और बस ये सब लोगों की जो दुआ मुझे मिलती रही कि हाँ चलो, एक को तो उसने उसमें से बाहर निकाला. और मुझे भी इतना सेटिस्फेक्शन हो रहा था कि हाँ, हमने ये कार्य से बहुत हम लोग संतुष्ट है. ऐसा है. तो तब से मुझे प्रेरणा मिल रही है कि नहीं, एक की जिंदगी सुधारेंगे तो हम हमारे लिए तो नहीं, उनके परिवार के लिए और उसके पूरा समाज के लिए और एक देश के लिए हम कुछ कर रहे हैं. ऐसा सेटिस्फेक्शन मिल रहा है. तो तब से ये प्रेरणा जारी है.
मैम जैसा कि आपने कहा कि ये एक फैमिली डिजीज है और हमारे देश में महिलाओं का एक फैमिली के अंदर, एक परिवार में बहुत ही ज्यादा महत्व होता है.
इम्पोर्टेंट होता
तो
है.
उसी दिशा में आपके, हाँ जी, आपके लिए आपके जो विचार हैं क्या है कि महिलाएं इस दिशा में कैसे योगदान कर सकती हैं?
नहीं, जरूर। ये जो फैमिली डिसीज है तो फिर क्या है कि महिला को बहुत ही सब कुछ भुगतान करना पड़ता है। ये जो जब भी कोई एडिक्ट होता है घर में, तो सबसे ज्यादा उनकी वाइफ होती है, उनकी माँ होती है, जो उनकी सिस्टर होती है, उन लोगों को ज्यादा बेयर करना पड़ता है। और ये सब जो है वो वुमेन्स के लिए और उसके फिजिकली और मेंटली हेल्थ के लिए भी ये सब जो है ये जो फैमिली वो एडिक्शन जो है वो बहुत ही वो मान्य रखता है कि भाई उनकी हेल्थ ऊपर भी असर पड़ती है, मेंटली और फिजिकली। हाँ।
हम आप बिल्कुल ठीक कह रही हैं। और एक महिला, आप खुद एक महिला हैं, आप फील्ड में जाती हैं, आप लोगों से मिलती हैं। तो जब आप फील्ड में जाती हैं, आप लोगों से मिलती हैं और महिलाओं से मिलती हैं, तो आप उन्हें किस प्रकार से आपको किन चुनौतियों का सामना करना पड़ता है?
नहीं, जब देखते हैं तो मैंने कभी कभी फील्ड में जाके भी देखा है कि जो आदमी जो उनका है वो जब घर कमा के नहीं लाता तो उनका चूल्हा नहीं जलता, बच्चे भी भूखे रहते हैं और वो खुद भी भूखी रहती है। और फिर क्या करते हैं कि कहीं कहीं पर ऐसा भी देखा है कि जो वुमेन्स है वो सुबह से शाम तक मजदूरी करती है और शाम को जब उनके आदमी आते हैं तो फिर उनको मार झूड़ करके भी वो सब पैसा जो भी कमाया हुआ है वो सब लेके चले जाते हैं। तब ये होता है कि नहीं, वुमेन एम्पावरमेंट होना ही चाहिए, वुमेन को सशक्त करना ही पड़ेगा, तो ही हम कुछ ये सब कुछ बदलाव ला सकते हैं सोसाइटी में।
आप बिल्कुल ठीक कह रही हैं, हमें विमेन को एम्पावर करना होगा और उन्हें भी सशक्त बनाना होगा अपने इस अभियान के तहत। और मैम, आप जब मैं आपने ये बताया कि जब आप इन महिलाओं से मिलती है, उनके ऊपर क्या गुजरती है, वो किस पीड़ा से गुजरती है जब वो इन लोगों से जुड़ी हैं जो नशे में लिप्त हैं। मैं आपसे जानना चाहती हूँ कि आप जब फील्ड में होती हैं, तो आप भी ऐसी कुछ चुनौतियों का सामना करती होंगी कि एक महिला होने के नाते। तो आप वो हमारे दर्शकों को बताना चाहेंगी?
हाँ, कभी कभी हम फील्ड में जाते हैं तो बहुत कुछ ऐसा एक्सपीरियंस होता है कि कई लोग हम लोगों को ऐसा बोलते हैं कि आप ये सब लोगों को सुधारने निकले हैं, लेकिन कोई सुधरेंगे नहीं। लेकिन तब हमें वो बोलना पड़ता है कि नहीं, भले ही हम 100 को समझाएंगे, 100 को समझाएंगे, लेकिन उनमें से 2 जो समझ पाएगा तो भी ये हमारा जो भी कार्य है वो सक्सेस हो सकता है। और कभी कभी साथ मिलता ही नहीं है। कभी कभी ये सब जो नशे वाले होते हैं तो फिर जब नशे में होते हैं तब हमें एक महिला कार्यकर करके फील्ड में थोड़ा सा तकलीफ होता है, क्योंकि वो लोग सुनते ही नहीं है। लेकिन फिर हम लोग ऐसा करते हैं कि उनके फैमिली वालों को समझाते हैं कि भाई नशे में से बाहर निकालने के लिए आपका साथ और सहकार भी बहुत जरूरी है। तो फील्ड में ये छोटी मोटी बातें बहुत ही फेस करनी पड़ती है एज ए महिला कार्यकर, ऐसा होता है। लेकिन फिर भी हमें एक संकल्प किया ही है कि नहीं, हमें उसमें काम करना ही है हमारे लिए, ये समाज के लिए और ये देश के लिए, तो फिर ये सब तो बैर करना ही पड़ेगा। और आगे हिम्मत रख के सबको सुधारना है, वो तो है ही, ऐसा है।
मैम, मैं बिल्कुल समझती हूँ कि हमें सबको मिलकर ही इसी उद्देश्य के प्रति काम करना होगा। मैं जानती हूँ आप बहुत ही अच्छा काम कर रही हैं। आप पिछले 25 सालों से हमारी अभियान से जुड़ी हुई हैं। मैं जानना चाहती हूँ कि आप इन जो महिलाओं से मिलती हैं, आप उनसे क्या चाहती हैं कि वो किस प्रकार से आके आपकी सहायता करें इस अभियान को आगे बढ़ाने में?
हाँ, तो जब वो सेल्फ हेल्प ग्रुप होता है, सखी मंडल जो होते हैं, आंगनवाड़ी कार्यकर वाले जो भी होते हैं, तो उन सब लोगों की हम लोग मीटिंग करते हैं और उन लोगों को भी हम लोग समझाते हैं कि भाई हमें सशक्त होना है। और क्या है कि ये सबके सामने हमें एक फाइट करना पड़ेगा, एक युद्ध करना पड़ेगा, तो ही हम सब एक जुम्बेश उठानी पड़ेगी कि ये नशे में से पूरे समाज को तो लाना है और पूरे देश के लिए हमें कुछ डेडिकेशन करना पड़ेगा। तो एक एक 1 to 1 करके भी हम लोग समझाते हैं और ऐसी महिलाओं का जो ग्रुप होता है उनको भी हम लोग 1 to 1 करके समझाते हैं और ग्रुप मीटिंग भी करते हैं और समझाते हैं कि भाई उनके सामने जो हम थोड़ा सा साथ में रह के सब करेंगे तो ये जरूर हम उसमें हम जीत पाएंगे।
बिल्कुल ठीक कह रही हैं मैम। बिल्कुल ठीक कह रही हैं मैम आप। जिस तरीके से हमें सबको साथ मिलकर काम करना होगा। मैं आपसे ये और पूछना चाहती हूँ कि आपकी जो संस्था है वो जिस इस कार्य में जो इस अभियान है उसमें काफी काम कर रही है। तो आप किस प्रकार से जो अवेयरनेस का प्रोग्राम है वो किस प्रकार से करते हैं?
हाँ,
कुछ
अवेयरनेस,
आप हमारे दर्शकों को आइडियाज देना चाहेंगे कि किस तरीके
जी
से? हाँ जी, हाँ जी।
जरूर जरूर। तो अवेयरनेस प्रोग्राम में क्या है कि सबसे पहले तो हम लोग बाहर जो जाते हैं तो उसमें अवेयरनेस लाने के लिए स्कूल कॉलेजेस में पर जाते हैं, ताकि वहाँ पर जो बच्चे हैं या तो फिर जो यंगस्टर है उनके लिए भी हम लोग प्रिवेंशन का प्रोग्राम करते हैं। और बाहर जहाँ पर जो वनरेबल एरिया है वहाँ पर हम लोग पोस्टर प्रदर्शन के अनुसार पोस्टर एग्जीबिशन भी करते हैं, और रैली वगैरह जो होती है वो भी करते हैं। और क्या है कि नुक्कड़ नाटक भी करते हैं, वीडियोस भी बताते हैं। और क्या है कि एनएसएस वाले जो होते हैं उनके साथ भी हम लोग ये प्रोग्राम करते हैं, साथ में जुड़ के गाँव में जो है तो वहाँ पर भी अवेयरनेस लाने की जरूरत है। तो जहाँ जहाँ पर लगता है कि हाँ यहाँ अवेयरनेस की जरूरत है तो हम सब जगह पे इस तरह का जो भी प्रोग्राम्स है, पैम्पलेट वितरण है, ये सब करके भी, और 1-to-1 है, इंडिविजुअल काउंसलिंग, फैमिली काउंसलिंग और ग्रुप मीटिंग करके भी ये सब अवेयरनेस लाने की कोशिश करते हैं।
Thank you so much, ma'am. I wanted to ask if Miss Durga is here, Durga Tripathi. Dr. Durga Tripathi, is she here? Can she hear me? Okay, I think she won't be able to join us. My next set of question would be to Miss C. Lekha. Oh, ma'am, can you hear me? I'm so sorry, Miss C. Lekha. Just first, ma'am, Durga Tripathi, ma'am, can you hear me?
हेलो।
Yes, yes, ma'am. Can you hear
हाँ, मैं
me?
सुन पा रही हूँ।
Sorry?
हाँ, बोले प्लीज।
Yes, ma'am, I wanted to ask you if being a woman position holder, is that any different from the other organizations that do not have leaders as women?
तो सभी पार्टिसिपेंट्स को नमस्कार। पहले तो मैं ये बात कहना चाहती हूँ कि
Miss C. Lekha, ma'am, can you hear me?
Yeah.
Yes, I would actually bring that question to you rather. You know, what can be the differences or what kind of environmental change would you think would bring, probably like positive mostly, would bring of that organization which has women leaders rather than men? Is there any difference to that?
Now, our institution, we led many environmental programs. eco-friendly street are the main objective of us. For example, Nalmidikatte is one of the street eco-friendly street. Is one such street in Kerala. Paintings, sculptures, awareness boards, and ornamental plants enrich the streets. We have done Bodhaniya Bethi as an example. It's our own sidewalk, enriched, eco-friendly, and creative artifacts and plants and trees. It's our street. We maintained the street with the plants, trees, flowering plants, etc. There is the people have many um, people very like this place to walk, and in the evening they sit there and they relax. That street named Bodhaniya Bethi, it is located in our institution street. See it as an environmental program to reduce nuisance of stray dogs by not throwing away food scraps. Such streets helps these stray dogs from the people. Mangrove forests are being planted along the banks of rivers and streams by us. Environmental quizzes are organized every year in our institution. The ambience of, I am saying this proudly and happily, that the ambience of Galaxy NGO or Galaxy IRCA itself is eco-friendly. That's all.
Yes, I think these are some great measures for being a bit ahead with the self-awareness regarding environmental sustainability and everything that comes with Mission Life. Thank you so much for bringing these nuanced instances from your life and sharing it with us. And I also share the rest of the guests who have come here and contributed what they have experienced and what they would want to do in the future. Sure.
We also want doing this type of programs for the society, for the people, and for the institutions.
Okay. Thank you, ma'am.
Now, I would like to thank all our guests for contributing to drug demand reduction. First, for this process to be successful, it is important that we bring in the elements that intersect Nasha Mukt Bharat Abhiyan. Because drug demand reduction has always required unique measures and collaboration amongst stakeholders, addressing external factors such as women's role, environmental sustainability will help bring nuanced issues and ideas to the forefront. Secondly, we think that a more comprehensive understanding of the factors that push drug use should be discussed. These shared experiences help us unearth very important aspects of the beneficiaries' lives.
Third, we very much welcome that in these thematic conclusions, there is an essential reference to how the environment and how women development actually is a powerful tool for the development, especially when it comes to drug demand reduction. So the process towards a multi-level understanding will benefit from our experiences with the existing research and facilities. Finally, we also, from the discussion, believe that there is a more fruitful discussion to come. So, as to how can we be more self-aware and conscious of the impacts we have on the environment, and how, even as humans, we can be so vital to the contribution of bringing activities inside organizations sustainably. With this, on behalf of Ministry of Social Justice and Empowerment and the NMDA team, I thank our revered guests for taking the time to be here with us today. and engaging so thoughtfully. I also thank our audience for being here today and making this a two-sided conversation. Lastly, I request the guests to wait for 2 minutes without interruption so that the NMBA team can capture a picture. Yeah. I request everyone to switch on their cameras, Miss Durga Tripathi and Alpa Vyas as well.
Dr. Abhavyas, can I request you to please switch on your camera?
Thank you all. Please keep watching our Instagram and Twitter pages for our website for updates on the activities. Until next time, thank you so much. Okay,
Thank you, everyone. Thank you for participating today.